I feel like talking about this makes it real, so I didn't want to do this, but I permanently lost my vision in my left eye after a skin treatment in Korea.
This is a case of rapid vision loss or an acute stroke of the eye related to a skin booster treatment which was marketed not as a filler per se, but still contained hyaluronic acid. My name is Dr. Tanya Trin, and we are going to discuss a few of the elements around this case, but before watching this video, I would really highly recommend listening to Esther Jong, the original creator's experience around this sequence of events, which she is still going through now. Firstly, I cannot express my condolences enough that she is going through this, and secondly, I would like to commend her bravery in sharing her story so openly, which has essentially gone viral around the aesthetic part of Instagram, and rightfully so. And really, she's still in the thick of this as this video is being posted. And she is a very, very talented ceramic artist and designer, and the loss of vision will have a profound impact on her ability to earn an income, practice her craft, and live out her life. Filler-related blindness is a topic that I have posted a couple of times about, and I will link this in my stories, or you can search them below. But suffice it to say that even in the best of hands, there is a complication rate which is estimated to be around about 1 in 100,000. And although that sounds rare, the some 30 million filler-related or skin booster type treatments that are thought to be performed around the world, and the amplification of these events on social media means that you will be noticing these events a lot more. The mechanism is where the injected substance has a thickness or viscosity about it that is enough to block a blood vessel. And because all of the blood vessels are intricately linked, it's a really deep, complicated network of blood vessels in certain areas of the face that are more vulnerable and less vulnerable than others. But essentially, after the blockage, everything downstream from that can become occluded and deprived of oxygen. And when you have highly oxygen-dependent tissues such as brain and retina, which is the image or light sensing area of the eye, then these are the areas that are going to suffer the most from the lack of oxygen and nutrients and cause dysfunction in these tissues, such as brain impairment or visual impairment or blindness. What is scary about these is that it can lead to blindness, stroke, and even death. And other symptoms can include a droopy lid, an inability to move your eyes, or even a death of the skin overlying the area that those blood vessels supply, to name the least of the whole host of symptoms that can occur. Here in Australia, our Royal College of Australian and New Zealand Ophthalmologists have released treatment guidelines in 2024 to assist treatment providers in recognising the signs and symptoms of when this is happening, and a rapid action treatment protocol that is required to get things into place to maximise the patient's outcomes. In this, it will also outline, and you can check it out on their website, which I'll also link below, that you need to contact the emergency department, explain what's happened, send the bottle with the patient, make sure that you have documented the vital signs of the eye and the vital signs of the patient's neurological function, what their balance is like, what their speech is like. You need to document the frequency and time of injection and whether you have administered a hyaluronidase, which is a dissolving agent to counteract the substance that you've just injected. And there's a whole plethora of other treatments, including, intense oxygen chambers that you can place patients into to try and optimize their outcomes. But any treatment provider needs to have a very clearly outlined protocol for what they would do if such a rare and devastating complication would arise. I also wanted to point out that this is not necessarily an injector-related issue, in that this complication can still happen in the best of hands in Australia or the USA or the UK. What I am saying, though, is the facts around the issue, and I'm not defending necessarily anyone or the procedure itself. It's not a procedure that I do myself, but I am the recipient of a few patients who have suffered harm from medical tourism, which is a completely separate post I'll make later. But in this case, what could have made a difference was the timely recognition of the signs and symptoms and the insistence on that Friday afternoon of getting access for that patient, knowing that critical acute time window to try and optimize her outcomes. Things that you can do to keep yourself safe. 1. You could just not inject around the periocular region and stick to a tailored skincare regime that improves skin quality and luminosity and pigmentation, which will just worsen dark shadows around the eyes when it comes to the natural age-related changes or the teardrops that form over time. And that might include a tailored regime of skincare, which might also include ingredients such as hydroquinone or azelaic acid or tretinoin. They are certainly not necessarily going to have the plumping effect, but they are certainly things that you can optimize to try and minimize that hollowed out look that most people are getting these procedures to try and avoid. And of course, sunscreen, sunscreen, sunscreen. 2. Go to a reputable, trained and qualified clinician who is able to not only discuss the benefits but the risks and complications, including what their treatment protocol would be if they had a complication and whether they have had experience in managing complications. And you have every right to ask about this at your consultation. And 3, avoid medical tourism, particularly if you are making that decision based on price. Not because all of the doctors in a particular country are shady, there are many qualified doctors in every country, but your ability to be able to distinguish through them and who is vetted and qualified and who is not, or navigate a health system when there are complications that arise, let alone speak the language because it's not your first language, or even have any funds to navigate the legal or medical system, it just gets increasingly more and more expensive for funds that you didn't have in the first place. So it makes it really, really difficult for you to access proper and timely legal and medical health care, and you are left extremely, extremely vulnerable. If you would like to support this artist who is now going through an incredibly financially challenging time, then you can follow her on Esther Jeong or Esther Jeong Ceramics. I'm not sure if she has products available through her website or a GoFundMe campaign, but it is worth considering if it's there. And if you would like to learn more about treatment-related filler-related treatment complications and the protocols to treat them, then please check out the Radsco website, and I will also link that down below. My name is Dr. Tanya Trin, and thank you so much for sharing your story. And I'm so sorry once again that this is happening to you.